Okay, so we have a new case today. Her name's Jennifer, a 30-year-old biracial woman. And so a brief overview of what you just got is that, so specifically she's Asian American, and she's Asian American, specifically Filipino. And so her life when she was a kid is she grew up in Seattle. She has a brother. Her biological dad died when she was 3 years old. Her mom remarried shortly after. The stepdad has an explosive temper. The whole family lived in fear of the stepdad's temper/outbursts. Jennifer's mother became very withdrawn and was not able to do basic tasks. So Jennifer took over these duties. In her life now, she has been living in Dublin, Ohio for 3 years due to her husband's change in jobs. And then Jeremy is her husband. He's an even-tempered man, kind and reliable. He is a physician at Ohio State University Wexner Medical Center. They have 3 kids together, and their ages are 2, 4, and 7. Jennifer is a stay-at-home mom, and life revolves around the family. Since this move, she has not remained. Since she stopped working, she has not remained any deep relationships. And then since the move, she's not felt right, and says that she feels hopeless. When she describes herself, she says she's unmotivated and tired all the time. When she asks if she would harm herself, she said she would not, but sometimes wishes that she would fall asleep and never wake up again. She has had a psychiatric evaluation and is diagnosed with major depression. Did you find anything out about the demographics?
Yes, so I just wanted to speak a little bit about the differences between Seattle and Dublin in terms of course demographics. From what we know about Jennifer, it seems like the move has affected her in her life, so let's take a look at these 2 places that she has lived in. So Seattle, Washington demographics. There are about 96,119 Asians and 49,165 Black residents. These are the second and third most common racial ethnic groups in Seattle. Seattle, Washington has a little over 400,000 white residents and 96,000 Asian residents. That's about 20% of the residents in Seattle are native speakers of non-English languages. And when I looked at the demographics of the Filipino community, 6.8% of the people in Seattle are of Filipino descent. The population altogether is a little over 685,000 people. The poverty rate in Seattle is 12%. The median household income is $80,349. Number of employees, around 415,000. So in this graph, it shows the non-English speakers in Seattle, Washington. As you can see, Spanish, Chinese, African languages, and Vietnamese are one of the highest, but also after that is the Tagalog language, which is the main Filipino language. It's the 5th non-English language spoken in Seattle, Washington. This just goes to show that in terms of all the people that are native speakers, you can see that the main language of the Filipino is one of the highest. When we're looking at the demographics in Dublin, Ohio, the Asian population is around 7,444, which is about 16.34% of the population in Dublin. And then Dublin, Ohio has an overall population of 32,149 white residents, and again 7,444 Asian residents. 18.5% of Dublin, Ohio residents are native speakers of a non-English language, and 2.6% of people in Dublin are Filipino. So this is much lower in comparison to the population of Filipinos that I talked to you about in Seattle, Washington. The overall population in Dublin, Ohio is 45,568. The poverty rate is 2.6%. The median household income is $121,020. And then the number of employees is about 21,987. Non-English speakers in Dublin, Ohio. We see that the Tagalog language, which again is the primary language of the Filipino people, is the 14th non-English language that's spoken in Dublin, Ohio. That is much lower in terms of the how the rate it was in Seattle, Washington, which is the 5th. language spoken. So that just goes to show how the population of Filipinos has decreased from Seattle up to Dublin with the move that Jennifer made.
Alyssa, what did you find during your evaluation?
So I met with her and I diagnosed her with major depressive disorder, and I also assessed her using the locus assessment, and her composite score came out to be 16, which puts her to level 2. So she's not too severe, but she does need some help. I would recommend outpatient care and community supports. And should transportation be an issue, I know she does have cars, there's lots of public transportation options in and around Columbus.
Nick, being her psychologist, what concerns do you have about Jennifer?
So after meeting with Jennifer, it was basically kind of like an intake thing. She told me about kind of what's going on with her and how she's currently feeling. My concerns with her as of right now is she's in a different environment right now, and she's kind of lost her previous community. So she's experiencing something kind of like a culture shock, where she's in this population in Seattle where there's like Asian population, and she has family that she has that support system, to now in Dublin, Ohio, where she has nothing. She has her immediate family, but she doesn't have any other deep relationships outside of her husband and her children, really. Her father died when she was a very young age, and her mother like quickly remarried shortly after that. So I'm concerned she never kind of coped with that with her father's death, since her mother moved on so quickly to a different stepfather. And in itself, the stepfather was emotionally abusive, didn't really physically harm her, but the family was scared of him kind of like going off and having these outbursts when she was like a little child. And another concern with me was her mother. Her mother did not seem to be present in her earlier years of life, because she had, looks like something similar. She had something Jennifer described as feeling blue, where she didn't really have motivation to do anything. She was in bed all the time, which caused kind of Jennifer to pick up the slack around the house and made her kind of have to grow up before she was ready to take care of her brother and make sure like everything around the house was getting done. And one of the other things I saw is it seems she kind of resented the life her mother had lived, because she's very involved with her children, while her mother didn't seem as involved because she had those periods of feeling blue, where she was just kind of like gone from Jennifer's life. She was like unresponsive to Jennifer's wants and needs. And it looks like Jennifer tried making her life the opposite of that, and now it seems like Jennifer is kind of falling into the same thing her mother did. Even the person she married is totally different from the stepfather that she had. But Jennifer, after the evaluation, she kind of told me that she really hasn't kept any like deep relationships ever since she moved to Dublin, Ohio. She hasn't been part of any organizations, any clubs. Since she's Filipino, she hasn't like joined any like multicultural like events or anything like that, or looked into anything around the area. She's not part of like any PTO or anything like that for kids, or kids sports or anything like that. And currently she's kind of experiencing something her mother experienced. She's tired and unmotivated all the time, and she's frequently crying and feeling hopeless. And one of the things that really concerned me, she said she wouldn't harm herself, but she wishes she would like never wake up again, which means like she wouldn't do anything to actually harm herself, but if something were to happen to her, she would just kind of accept it.
So Jennifer gave me a brief overview of what the family makes monthly, and basically they're able to afford for her to do they're able to afford really anything. So they're able to afford like daycare. They can afford for her to go to therapy and like do outside activities if they want to.
So she has really great insurance. She has Prime Care Advantage through Ohio State University. Prime Care Advantage covers 7 antidepressants, but they're generic and they cover 1 name brand. There's usually a $10 copay, and she must use an in-network pharmacy. And I looked up some pharmacies, and Rite Aid is within 30 minutes of Dublin, but Walmart has 2 locations in Dublin, so Walmart might be the better option for her. She should meet with her primary care physician to talk about what prescription options are best for her. And there's no annual deductible for outpatient care, and they offer a lot of in-network providers. I narrowed it down to 6, 3 of which are affiliated with her husband's work and 3 of which are not, so whatever she's comfortable with doing. They are currently accepting patients, and they specialize in depression and anxiety. They also offer family services should her kids or husband need it later on, so if things don't work out with Nick, she has options.
So I looked at the daycare options for the 2 and 4-year-old, and there's 2 options that they could go to. One is through the dad's company, and so he could bring them to school. And the one that I thought was the best was they would go Tuesdays and Thursdays, and it was like from 6 a.m. to 6 p.m. And that one actually, the cost of it was a lot higher, so it was like $1,000 a month. And then there's another one that was closer to home, and it was it's called Dublin Community Preschool and both the 2 and the 4-year-old can go there, and they can go Monday, Wednesdays, and Fridays from 9 a.m. to 11:30 a.m. And so it works. Either one works. It's up to which one is best for the family in the long run.
So there are a few community centers and services that can be provided for the Asian American community, more specifically the Filipino American community, and one of them is the American, it's actually called Asian American Community Services. So AACS for short is composed of 4 major departments: community, education, interpreting and translation, healthcare and prevention, and youth and family. Their main goal is to improve the lives of the Asian American community and Asian American immigrants in general by providing some very much needed social services that empower and enhance the well-being and quality of life for this community through education, training, leadership. This organization is another service for Jennifer to use in order to feel more connected to her culture and her roots. It can be very stressful not to feel out of place and not connected to any particular group of people or lifestyle. So this organization is going to be able to help Jennifer with this dilemma and provide her some needed resources as well, not just connected to her mental illness, but also her overall health and well-being. So there's actually a website that you can just go online and find it. So it's very, very easy to access. There's no barriers or anything like that to it. Another organization that can help Jennifer is the Asian Health Initiative Free Clinic. So this is a collaboration between various departments in the Columbus area that created this community project that seeks to improve and increase access and improve the health of the Asian population in Central Ohio, which includes Dublin. This community is considered underserved medically because of the cultural and linguistical barriers between the community and the medical world. So this organization provides the appropriate services that the Filipino American community needs in order to be healthy and well. Their goals are to improve access to health care, assist in maintaining good health, and to promote health screenings in the Asian community. Again, she can access all the information that she needs at their website, which is very easy to access. And she can also get more information on if they're having events or services as well. Another organization that I came upon is the Philippine American Society of Ohio. So I think this organization can greatly benefit Jennifer in the long run. So it was established in 1967, and it's considered the first Filipino American organization in Ohio. So as you can see, obviously it's been running for a really long time. It provides a place for the Filipino American community to gather and hold events and workshops to educate and come together in order to improve its community. It is a place for Jennifer to be involved with as part of her treatment, so that she can become closer to her culture and maybe find friends and connections that have the same background as her. This organization has numerous events and workshops for mind and physical health, and I think Jennifer would very much benefit from either or both of these things. They hold events on taking care of yourself and just your overall wellness. This is really important for Jennifer because with major depression, it's very easy to focus on the mental illness and lose track of the health and physical wellness. So this, I think, like these specific events will be able to help her. They have Zumba, dance, as well as a few yoga sessions. So if Jennifer wants to sign up or is interested in any of these classes, which I do recommend, she can just again go online and there's an actual event listings and it shows you the dates and the times that she can go. And she can actually work around her schedule because there's multiple sessions there as well. Another thing that I realized is the PTO opening at Jennifer's oldest child's school. So she can actually go to it and there's multicultural events that she can be a part of while also being a part of her child's process in education.
So, Jennifer, how's everything been?
I'm doing better.
Mm-hmm.
Yeah, I've been on medication that's working. The first one that I tried didn't really work out so well,
Mhm.
so my doctor worked with me and adjusted it and changed to a different one.
Mhm.
Decided that was better.
Mm-hmm.
I'm involved in the PTO
Mm-hmm.
at my oldest school, and I've gone to some of those events too
Mm-hmm.
that you recommended to me.
Mm-hmm.
And I really enjoyed it. It was actually really fun, and my family came to one of them,
Mhm.
and we just like had a good time, and I felt like I was a part of a community again.
Mm-hmm. Have you done any of those more multicultural events? Found
Yeah.
anything? Mhm.
Mm-hmm.
Have you anything in particular that you've done, or?
There was one dinner that we went to with my whole family,
Mhm.
not too far away, and just like being around the culture again, and like eating the food and getting my kids involved in it too was just like really nice.
Mm-hmm. How is it managing everything with your kids and stuff and your treatment?
It's not easy,
Mm-hmm.
but it's manageable. I'm getting through it every day.
Mm-hmm.
I think just taking it one day at a time.
Mm-hmm. Do you feel too far apart from your kids since you have to go to the outpatient facility and you have to have them in daycare? Do you feel like far apart, or is it good?
I'm not as with them as much as I was, but I still feel involved in their lives, and I think that's what's important to me.
That's good. That's good.
And I think, I'm not putting the pressure on them that I felt when I was younger,
Mm-hmm.
and I'm glad for that.
I'll meet you again next week for another session.
Good.
I'm glad that you're doing well. Just be aware that even though you're doing well now, there might be a point in the future where you're not doing as well. You might hit very low period. And in any situation like that, either call me, I'm always on call, or if you can't get in touch with me, go to a hospital right away or call a hospital to try to seek out care, because we don't want you to hit a very low and make it hard for you to recover from that. Okay?
Okay. Thank you.
Have a good day, Jen.
You too.